This is the Penn State heart, the heart that was used to keep Tony Mandia alive for 10 days here at the Hershey Medical Center in Hershey, Pennsylvania. But this is nothing compared to this new heart. It has a microprocessor in it that controls all the functions of the heart. It will be ready for implantation in about 5 years. It's just one example of how computer technology is being used in medical research. Today, we take a look at computers and medicine on this edition of the Computer Chronicles.
The Computer Chronicles is made possible in part by AFIPS, the American Federation of Information Processing Societies. AFIPS, along with these constituent societies, brings you the National Computer Conference, NCC 86, offering a showcase of advanced technology and the industry's foremost professional program. For conference information, call 800-NCC-1986. Additional funding is provided by McGraw-Hill, publishers of Byte. Byte's detailed technical articles on new hardware, software, and languages cover the latest in microcomputer technology worldwide. Byte, the international standard.
Welcome to the Computer Chronicles. I'm Stewart Cheifet, and this is Gary Kildall. Gary, what I have here is something called a laser card. It looks like just a credit card, but it's actually called a life card because what it has on here is 800 pages of medical information, including x-rays, EKGs, the complete medical and pharmaceutical history of the patient that carries this card. And you may think this is kind of something out of Star Trek, but it's not. It's being used right now by Blue Cross in the state of Maryland. I think it's one good example of how computer technology is being used in the medical field. And I would think, Gary, that computers could be used in a variety of ways in medicine.
Well, medicine, like law, is very information intensive, and cards like the Drexler card help us manage that information. But computers in medicine, they're used anywhere from measuring your body temperature to CAT scanners, and the list goes on and on. Now, the future, well, artificial intelligence, expert systems, maybe someday we'll have the doctor in the box, who knows?
Well, we won't see that today, but we'll see several examples of how computers are being used in medicine now. We'll see some software that helps diagnose lung disease and eye problems. We'll see how computers are being used in hospital emergency rooms, and we'll see a computer program that helps to develop cancer treatment. Now, we're going to begin by taking a look at how computer graphics are being used to help design replacement parts for the human body.
The most common tasks given to computers usually involve time-consuming or tedious jobs that humans don't otherwise like to do. But in the medical field, computers are more than time savers, and new applications can produce radical results. An image processing computer, developed by Contour Medical Systems, is capable of reconstructing the shape of damaged parts of the human body to permit nearly flawless repairs. Working from X-ray slices taken by a computerized tomography scanner, the CMAX can create three-dimensional images of bone structure or soft tissue. For many kinds of surgery, it's a dramatic departure in method.
It really began when I was a junior resident at Stanford and saw the means by which facial reconstruction was undertaken. And we essentially would take a planar projection X-ray that would have multiple overlying shadows and try to make a diagnosis on that basis. And once we had done that, we'd go to the operating room, open the patient, and try to reconstruct what we thought was there. Often when we got to the operating room, we found that the diagnosis was different from what we had thought it was. And then we would be faced with going down to the hip or the ribs and taking a piece of bone, bringing it up and carving it. The definition of what the problem was wasn't clear, and then it really relied on art and the ability of the individual physician to carve what had to be placed and have him place it. What I was trying to do was to make it a scientific, well-defined exercise.
The system begins by highlighting selected areas of the scan, picking out the boundaries of different tissue densities. In this cross-section, looking up from the jaw, the skull bone is distinct from the inner organs and soft tissue because of its different mineral density. Each slice can be examined this way to assess the kind of surgery required. In the case of unilateral damage, CMAX will first create a mirror image of the intact side and then fill in the missing parts for perfect symmetry. The software provides a neat mathematical solution to an aesthetic problem, with some limitations.
Computers won't replace surgeons, and what one can deliver in the operating room is affected by lots of other things besides mathematics and cybernetics, and there are so many factors that affect what can be delivered that generally in a facial malformation of that magnitude, one tries to get a reasonable looking face, but nature and physiology don't allow us the luxury of picking specifically the fine nuance of what detail we might like.
To complete the process, once the program has designed a screen model of the missing part, a plastic mold is carved by a software-driven milling device. The mold yields a precise model of the final synthetic or bone graft replacement.
I think that there's going to be a computer explosion in medicine over the next decades, and this is the beginning of an exciting era and approach to surgery and medicine, and the computer and the physician are going to be inextricably linked.
Joining us now in the studio is Dr. Ben Honigman. Dr. Honigman is the Director of Emergency Medicine at the University of Colorado's Medical Center. And next to Dr. Honigman is Mark Tuttle, a lecturer in computer science at UC Berkeley and a specialist in computers and medicine. Gary?
I'll start with a real general question for Mark, and just how effective the use of computers been in medicine these days?
In some areas, they've been extremely effective, and in others, not effective at all. Mm-hmm. And if we take a patient coming into an emergency room or a doctor's office, at the moment they walk through the door with some complaint, almost anything in the world could be relevant to that patient's problem. At this point, computers have not been terribly useful because we can't program a computer to measure relevance. On the other hand, as the problem that patient has becomes more narrowly defined, we eliminate the 99.9% of the things which are not relevant. We get into much more specialized knowledge where the explosion in medicine of this specialized knowledge has put great burdens on physicians. They can't remember all this stuff. Mm-hmm. And at that point, having made a decision that the patient's problem is in this area, computers have been successfully applied in a number of different contexts.
So it's the initial diagnosis where it's very difficult to put all the facts and materials together.
Yes, because of that relevance problem.
Mm-hmm. Okay, now Ben has a product, representing the use of a product here called PoisIndex, which is very unique in the sense that it has a lot of information stored in a little compact disc. And so this, I guess, is a specialized area, isn't it?
Well, it's more than just a toxicology product. It is a product that contains information about a number of different relevant areas. Drug information, clinical information, and as Mark has pointed out, there is an explosion of information out there, and what this attempts to do, what this computer program attempts to do, is to try to get as much accessible current information as there is in the medical literature.
One place this might be used is in the is in an emergency room?
Yes, and in any sort of critical care area, be it an emergency room or an intensive care unit. And we can actually go through an example of how this can be utilized. For example, if we have a toxicologic problem, since you happen to mention that, someone comes in with a poisoning, and we happen to find an empty bottle of aspirin next to a child that has taken this poisoning. This creates all sorts of havoc, obviously, in the parents and in the medical care workers as well. If we go to the computer and we type in aspirin, it will lead us to an index that will go through manufacturers of aspirin. Then from the manufacturers we can find out exactly what is contained inside each of these tablets and go to a management of those tablets just by following the simple instructions that it's...
I think it's probably worthwhile again mentioning that you have lots and lots of information. It's just stored local here. This is not an online system.
No, this is not via phone lines, and it's that's an important point, that all of this information is stored on one of these CD-ROM disks, and there's over 250 megabytes of that information. If we wanted to find out the treatment of this particular ingestion...
Now, why wouldn't every doctor know the treatment for aspirin toxicity?
Well, there are some idiosyncrasies about the treatment in terms of severity. If it's a mild aspirin toxicity, then obviously the kinds of therapeutics that would be needed would be a lot different than if it was a severe toxicity. And if we can go to another portion of the computer, a more dynamic portion, we can find that once we've obtained the amount of aspirin that this child contains, we can
So
type
this is a
that
blood
in.
test
This is a
result.
blood test result that we've obtained from the laboratory. We determined that it's the ingestion is about 6 hours old, and we see that this is a very severe toxicity. Once we know it's a severe toxicity, then there are different parameters of treatment that we need as opposed to the milder toxicities.
How would a doctor have found this information before a system like this was available?
Before this, there would have to be searches through textbooks, or searches through journals, or searches through microfilm, or other kinds of mediums.
Or they'd make the wrong choice.
Well,
they wouldn't make the search.
Or they wouldn't make the search, and they may have...
Make the best judgments they have
That's
in the
right.
circumstances.
Now, the nice thing about this is obviously that the kinds of treatment that we can utilize or obtain information from this can then be transported to our colleagues in the hospital from the emergency department by just printing out this data as it comes from the computer. The other areas, let's say the child happened to have a cardiac arrest, just the heart stopped. What we can then do is, children have various weights, and we don't know what the exact dosages are for any particular child in terms of that weight.
And what happens if they get the dose wrong?
Well, because of the small size of the child, any wrong dosage might create havoc in terms of treatment. Let's say we didn't even know what the weight was, but we guessed that the child was 24 months old, or we knew that the child was 24 months old. What the computer can then tell us is give us specific information about dosing for that weight or age of a child, and then again we can print that out and utilize that at the head of the bed and go from there.
In the sense of all the lawsuits and so forth against doctors these days, do you run any risk of being sued if your information is, say, wrong in a situation like this, and some entries are wrong?
It's an interesting question, and it's a gray area as far as the courts are concerned. No one really has an answer for that yet, and in the same way that textbooks are deemed to be an appropriate source of information, I think computers now are also deemed to be an appropriate source of information.
Now, Mark, this is all very impressive what Dr. Honigman has showed us, but
Very
in fact, doctors seem to have been slower in getting to use computers than lawyers or other businesses. Why is that?
One of the answers is that there's a fundamental confusion about the worth of their judgment. Some doctors would take pride in the fact that they were helping their patients by doing this calculation in their head. Whereas no mathematician or engineer would ever design a bridge and say, I'm giving my client more of their money's worth because I designed the bridge in my head, rather than using the formulas which everyone agrees to apply. Now, some of the biochemistry here is very well understood, and there's no reason why that part shouldn't be handed over to the computer.
So you mean to suggest a doctor might think he's not as good because he has to go to a computer to get the answer. Is that true?
Some of that is very relevant. Another important area, I think, is that computers up until very recently have not been very friendly in terms of being able to access it. It gives you numerous instructions, numerous codes. You have to look in manuals. You have to dial up a phone. You have to do all sorts of things. And it makes it more difficult for a physician to actually obtain the information. It's easier to go to a book and then open it up and find that information as opposed to going to the computer.
In simple terms, a dock is bigger than a PC.
Gentlemen, thank you very much. Now, in just a minute, we're going to take a look at a computer program that diagnoses eye disease. First of all, we're going to look at Puff, not a magic dragon, but a seemingly magic artificial intelligence program that analyzes lung disease. Wendy Woods reports.
They call it Puff. It works in the Pulmonary Function Lab at Presbyterian Hospital in San Francisco. It's a true expert AI system that diagnoses lung ailments. Designed by Dr. Robert Fellett in cooperation with Stanford University, the system duplicates Dr. Fellett's own thought processes. It assimilates data from patient tests and translates it to a diagnosis that Dr. Fellett would make himself, using common English sentences.
It doesn't list phrases, it actually puts everything out in the English language, and it speaks the same way that Dr. Fellett speaks, and even actually uses his punctuation.
Puff runs on a Tektronix terminal connected to a hard disk. Its central memory bank is due for the first major revision in its 4-year operation. If the new version proves successful, Puff will take the name MicroPuff and work on PCs, and it will be commercially available from Medical Graphics of St. Paul. The software's biggest selling point will be its time savings.
The time saving is actually really phenomenal. The amount, the volume of patients that we do, we literally have increased our patient load 100% in the last 2 years. But we've been able to keep up with it, and we haven't had to increase our staff by 100%. We've only had to hire one part-time worker.
Medical costs are rising 3 to 4 times the national inflation rate. But here at Pacific Presbyterian Hospital's Pulmonary Function Lab, they haven't, mainly because of PUF. When you don't have to hire people, you save money. So instead, they hired a computer. For the Computer Chronicles, I'm Wendy Woods.
Joining us now in the studio is Dr. Chandler Dawson, director of the Proctor Foundation at UC San Francisco, and also Dr. Mark Musin with the Medical Computer Science Group at Stanford University.
Mark, I remember when I was going to school, and 10 years ago studying computer science, there always seemed to be a project going on in artificial intelligence relating to medical diagnosis of some sort. Has there been any progress in the last 10 years?
I think there's been enormous progress. It is interesting that the domain of medicine has been the area where a lot of artificial intelligence research in general has been directed. There are certain things about the domain of medicine which make it interesting for that work. I think what we're beginning to see now is that a lot of the work that was done in the last decade is being put to practical use to some degree, and that's very encouraging.
Now, your particular project, could you tell us a little bit about that?
Sure. I'm working on a system called Oncosin, which is an expert system at Stanford which provides advice to doctors who are taking care of patients who are undergoing chemotherapy according to certain protocols.
Now, is this actually, it's in practice, it's a practical usage of the program, right? It's being used day to day?
That's right. It's used in an experimental way in the oncology clinic right now.
Now, what has the success of that program been? Do the doctors like it? Is it a threat? Does it help them out?
Well, it certainly represents a way where computers are being used in a new way, and so the doctors approach it with some degree of ambivalence, although they're certainly surprised at how well it's able to give advice in certain regards. We find that generally if the physicians disagree with the advice of the computer, when expert faculty members have reviewed those cases, it turns out about half the time the expert faculty member would have agreed with the physician, and half the time would have agreed with Oncosin's recommendation.
I see.
Dr. Musin, give us a specific example. What kind of information would you feed into this program, and then what kind of information advice specifically would it give the doctor?
Well, we're dealing with patients who are undergoing very intensive treatment for cancer. And generally that involves many different kinds of drugs which are given in special sequences over time. And what Oncosin determines based on how the patient is doing clinically, based on certain laboratory tests and so forth, whether it's appropriate to give treatment, and if so, exactly what treatment, what drugs, what their dosages should be, and if necessary, what new lab tests need to be ordered in order to adjust treatment the next time around.
Now, Chan, you have I guess we could say is the other end of the spectrum here, a smaller PC-based version of a diagnosis program. Can you tell us a little bit about that?
Well, this is a program to give advice on how to take care of eye problems, but it's aimed at healthcare delivery people in developing countries, the sort of barefoot doctors. These are people who've had very little training. They change frequently.
And people who are in fact not doctors.
They're not doctors at all, by and large.
Okay, so this is also expert system based, though.
This is expert system based using the expert shell from Rutgers.
Okay.
And
now, how would you get your expertise into it? You're a doctor, and could we go through a kind of scenario where we would build a program?
Why don't we have a case presented to us? Does anybody have anything wrong with their eyes?
You talked earlier about the fact that my daughter has an eye infection that comes up, or appears to be a redness.
How old's your daughter?
She's 14.
14, so she's 12 to 18 years old. And her eye gets red from time to time?
Red, yeah, just in the white part of the eye.
Not painful at all.
No?
And she's had no injury to the eye, hasn't got any chemicals in the eye at all, so we'll say none for that one. And no foreign bodies in the eye. She's got something stuck in the eye. Let's see, the white part of the eye is red, though. Okay. She's had no pus with it, though. So her vision is all right. That hasn't changed at all. Okay. Does light hurt her eyes? Does it water at all?
No.
Okay. So the surface.
I feel like I'm in a doctor's office.
That's right. It's clear. There's no discharge from the eye at all. So none of these. And there's no blood inside the eye, and she hasn't got a cataract showing.
I don't think so.
Yeah. Don't have any trachoma in the community, I trust, down there. And it's happened, but it does happen again and again.
Yes, it
okay. Now, as the program is under development, I'm putting in my expertise at this point
Okay.
And so it sounds to me like she has something called a pterygium. Let's see if I spell it right.
Now you're going to check and see if the program comes up with the same diagnosis at this point?
Well, this program doesn't do a diagnosis. This is intended just to do treatment.
Oh, I see.
Okay, so you are doing the diagnosis.
I'm doing the
right now,
diagnosis
and you're now
here.
putting your answer into the computer.
That's right. And so we're going to say a vasoconstrictor. And this summarizes the findings on the program. This is a child between 12 and 18. The eye is red. The white part is pink or red. And the problem does happen again and again. And then my diagnosis and recommended treatment there. And then here's what it advises to do, which is give a topical antibiotic. Now, this, while it may not be appropriate here, these healthcare delivery people have topical antibiotics. That's their one medication they have to use.
So the theory is now, when this program is developed, somebody in some third world country will interview a patient which responds in the same, who responds in the same way Gary did, and the computer will then give them the advantage of your expertise in diagnosing.
Now this also, you mentioned earlier, it would be appropriate for a handheld.
Well, we're aiming at putting it into a
system.
handheld with EEPROMs. If we could use that CD technology you just showed, that would be terrific, because we could show pictures along with it to illustrate the various problems.
Would you see a use for this, not in third world countries, but say in this country, in some sort of home advice situation where I might have that on my computer at home when I see my daughter has a spot in her eye?
Well, I think that would be very helpful, yeah, and particularly sorting out the problems that are serious or not serious. Obviously, the general approach is primary health care for all health problems.
Now, how close is this to being, let's say, a completed
well, we're going sort of the
device?
beta testing, field testing this winter in North Africa.
Now, this basic approach now is the same. This is a low-end, high-end system based on expert system, not just a set of rules that somebody typed in here, but it's actually based upon a very well-tested and thought-out process of expert systems. Do you really feel like this is going to be very productive, both of you? I guess the question maybe for Mark, are we really going to be seeing expert systems replace a lot of the, say, diagnosis process, say, in the next 10 years or so?
That's a difficult question, because most of the work that's being done now is still very experimental. I think we're going to see expert systems in widespread use toward the narrow end of that spectrum that Mark Tuttle alluded to earlier in the program. As far as more complicated experiences, it's really hard to know. There are a lot of fundamental questions in artificial intelligence that also need to be solved before we can see a lot of practical expert systems in this field, I think.
We have just about a half minute left. Dr. Dawson, is computer training getting into medical schools? I mean, are doctors learning about this?
More and more they're learning at the medical school level, and particularly even at the postgraduate level now, we're using computers to access the National Library of Medicine database so we can look up particular subjects very quickly and really get a thorough review of that subject.
Okay, we're out of time, gentlemen. Thank you very much. Well, some people think using computers to come up with medical advice is a very good idea. Some people don't think it's a very good idea at all. We've asked our commentator, George Morrow, about his opinion.
Computers and medicine go so well together. Let's see if we can understand why. There are 3 points, I think. The first has to do with the acceptability of these devices to the doctor. They're a part of his life from the time he starts school well into his practice. Second, medicine by its very nature is filled with disappointments and failures, and any device that reduces this is a very powerful psychological feedback for the doctor. And thirdly, they're trained to be suspicious of data, whether it's from an experiment or whether it's from the symptoms of a patient. So when they apply this suspicion to computers, they make sure that the software is well wrung out, the bugs are gone. We have here a perfect formula for applying computers to any number of applications. That's the way I see it. I'm George Morrow.
In the Random Access file this week, MS-DOS on the Macintosh. Reports are that Apple President John Sculley has told industry analysts that Apple will soon offer the MS-DOS operating system as an option on the Mac. Apple says it does not plan to get into the PC clone business, but said MS-DOS and Unix would be available on future Mac systems. You've already heard the news, no doubt, that Burroughs wants to buy out Sperry. If the deal goes through, the new Burroughs-Sperry conglomerate would have combined annual computer sales of over $10 billion, making it second only to IBM. The stock of both companies has soared, suggesting investors like the idea. Some disturbing research out of London this week. The British National Library has been looking into converting to optical storage, but after testing CD-ROMs, the British are challenging the claim that the laser discs last forever. The research shows that after about 10 years, the lacquer coating on the discs can crack, leading to oxidation of the underlying aluminum surface. The researchers said the small cracks would not affect video or audio, but could be catastrophic to data. The study questions the safety of putting archival material on the laser discs. In our Washington Update file, the FCC has requested comments on a Motorola proposal for a wireless computer network. The Motorola proposal would interconnect computers and peripherals via low-power radio frequencies. The proposed system would allow users to move computers around an office and go from device to device without having to drag around or reconnect cables. The system would work within a range of 500 feet. On Capitol Hill, the House Judiciary Committee has approved and sent to the full House the new computer crime bill. A similar version of the bill is moving through the Senate. Passage is expected by the end of the year. Time for this week's software review, and here's Paul Schindler.
It just so happens that I like apples, so I'd eat one every day even if they didn't keep the doctor away. Besides, doctors don't make many house calls anymore anyway. But for those occasions when an apple isn't enough to keep you well, you might appreciate the help of a computer program called Apple a Day. This program is a lot of things. It's a repository for medical records, a source of health provider information, and an online medical encyclopedia. As with all generalized medical advice, the program warns you not to follow its serious suggestions without first talking to a physician. That's good advice. The online medical guide covers everything from acne to venereal disease. One example of its advice is hangovers. It helps you decide if you're suffering from one, and then offers advice on how to avoid them. It suggests eating some cheese before drinking. Or, if you have a headache, it takes you through a series of questions to figure out why you have a headache. It also has a section for all your medical telephone numbers. What Apple a Day doesn't have is any color, making it pretty tedious to look at. Still, it's a great idea, and there aren't many packages like it on the market. This one comes from Avant-Garde Publishing in Novato, California. For the Computer Chronicles, I'm Paul Schindler.
Two new interesting portables on the market. Toshiba has come out with the first AT-compatible laptop. It features a full-size gas plasma display, a built-in 10 meg hard drive, and a 3.5-inch floppy. And Data General has shown its second-generation laptop, the DG2, features an electroluminescent display, a 10 meg hard disk, and up to 640K of internal memory. When you get your new Sharper image catalog next month, you'll see on the cover the world's first low-cost picture phone. The picture phone technology has been around for 20 years but never quite taken off. Now Mitsubishi is coming out with a home picture phone for under $1,500 that sends still photos over ordinary phone lines. It takes a few seconds to send the picture, during which time you can't talk. The new Pic phone is being distributed by Luna Telecom of Santa Clara, California. Finally, from Carnegie Mellon University, that respected research center for robots, parallel architecture, and the world's best chess computer, comes a new project called Sexpert. It's a sex therapy program developed by Dr. David Servan-Schreiber. He says research shows people talk more candidly about their sex problems to a computer than they do to a human therapist. The computer program asks about 100 multiple-choice questions and then recommends a treatment program for the couple. The software is expected to be available in the future for the Mac and the PC. That's it for this week's Chronicles. We'll see you next time.
The Computer Chronicles is made possible in part by AFIPS, the American Federation of Information Processing Societies. AFIPS, along with these constituent societies, brings you the National Computer Conference, NCC 86, offering a showcase of advanced technology and the industry's foremost professional program. For conference information, call 800-NCC-1986. Additional funding is provided by McGraw-Hill, publishers of Byte. Byte's detailed technical articles on new hardware, software, and languages cover the latest in microcomputer technology worldwide. Byte, the international standard.